Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, and joining me today are two representatives from the county, and specifically we have the County Board Chair, Daryl Standafer. Hi, Daryl.
Jamie.
And Fred Johnson, who is the Director of Health and Human Services. Well, thanks for joining us.
Yeah, glad to be here.
Well, we have a county that has roughly 85,000 people, or 84,000 I think was the last census in 2010.
A little over 84,000.
And I asked Daryl to come here today to explain maybe the impact of some recent changes in state laws and how that might affect. Now, as we tape this segment, the Wisconsin law regarding stripping collective bargaining from public employees is in the courts. It's, I think, on appeal right now.
Temporary restraining order.
Yeah, there's a temporary restraining order, and I just read an article about an appeal, which by the time this gets played out, maybe that appeal will have been granted and heard by the Supreme Court. Don't know how fast they will act on that. But we're not here to discuss that so much as just impact on the county budget. And I don't want to get into the should-haves and could-haves, but more or less, where are we at as far as the county? Because I think statewide we're considered fairly affluent. We have one of the higher per capita incomes and one of the higher per personal property residence values. And so maybe we are doing better than some counties, but what impact might this legislation have, assuming that it is affirmed in its current form and published and becomes law? So Daryl, why don't you explain why Fred's here? Because as we take the broad view of the county budget, I understand it's roughly $84 million budget, and roughly a third of that is from the property tax levy. And then you have various departments, and I don't know if we need to run down all the different county departments. Folks can go on the county website if they want to look at that.
That would be preferable.
Yes, but Health and Human Services is certainly a very important aspect to the entire county budget. So why don't you tell us about that?
Well, first of all, I'd like to explain why Fred is here. And since I was going to be spending a little time with you today, Jamie, I thought I would have your cousin come along. So now I'm flanked by the two Johnsons here. So no relation, right?
Right.
Well, seriously, the reason that Fred is here is he is director of our Health and Human Services area, and that's one of the larger areas for the county. And as we are looking at anticipated changes in our revenue projections and therefore our expense capacities for next year, it just seemed to me important to have Fred here because it's one of the areas that will be impacted the most because it's one of the largest ones.
Okay.
You indicated that we're about 84,000 people in the county. St. Croix County, as you probably over the last couple of weeks have seen some of the press stories, continued to be one of the fastest growing counties in Wisconsin, and I guess the actual growth that we had over the last decade was a little over 33%. That growth, of course, is the good news, and it's also the bad news.
Right.
It puts a lot of pressure on our services and our infrastructure and everything else. With respect to the budget, there are really two aspects about that. You were focusing to a certain extent on the budget repair bill, which was addressing the remainder of this biennium and some of the changes that were in that, including some of the changes in collective bargaining. But the focus that we need to be looking at is the biennial budget for 2011-2013. State of Wisconsin is on a 2-year cycle.
And they go from July 1 to the June 30th of
That's
the 2
correct.
years
The fiscal year of the state begins in the middle of the year. The county, of course, is on a calendar year, so our budget that we're currently operating is our 2011 budget, and we are now into the end of the first quarter. We've completed 1 quarter of that budget, so there's a little bit of different timing in those budgets. But the reality is, as the state is looking at the next biennium, the money is gone. I mean, the state is looking at about a $3.6 billion deficit in the next biennium. About 2/3 of that you could say is maybe attributable to the economy and the recovery that we're now starting to see, but about 1/3 of that was a structural deficit. which means that previous legislatures have moved a problem down the road, and eventually there's a day of reckoning and has to be dealt with. And the thing that I'm encouraged about is that there seems to be a very good awareness that we can't continue to kick that can down the road. We've got some problems, we need to address them, and I think that's what we're now seeing, because some of that rolls down to counties and other local units of government.
And that's what we want to address, because
And that's what we'll address today.
I mean, I think that St. Croix County has had a recent history of doing a great job trying to sharpen their pencil and cut where they can. And for those folks, again, referring to the St. Croix County website, if you want to have information regarding the 2011 budget, I think there's a 43-page PowerPoint presentation that's on there, all with graphs, and explains some of the things we're going to cover today, but with a lot more detail, of course. You had mentioned that Health and Human Services is a large part of the budget. Roughly, I guess it's 35%, as I was reading this pie graph anyway.
I think about 35%.
That sounds about right.
Yeah, it's a little over a third.
And with this collective bargaining part of the budget repair bill, because in actuality, I'm not sure, has the budget repair bill itself actually passed? The part that was the fiscal part that required the senators to be in Madison, I don't know if that actually got signed yet, but the collective bargaining part, which was my last guest, Dean Knutson, had indicated is really vital for the future budgets in the 2011-2013 biennium you spoke of. That tool, that will be hopefully a tool that local governments and school districts can use. But how are they going to use it, and what impact is it going to have on services? And that would be why, I guess, Fred's here. Is that right?
Well, not necessarily. Fred is here really because of a number of the things that we're going to see are going to be in programs that are administered in the HHS area. The collective bargaining piece, and you did have a good discussion with Representative Knutson on that, and I don't know that we need to go back and plow that
That's right.
plow
We
that
said
ground
from the beginning
again.
we wouldn't do that, right?
Yeah. Not that I am reluctant to do it, I just don't think it's necessary. You've had a program on that. But as Dean pointed out, that was really in anticipation of the biennial budget for 2011-2013, right, and giving some tools and flexibility to local units of government. I think it's going to make them a lot more efficient, and frankly, it's going to make them a lot more accountable too, because that's where the decision is going to be made. But the reason that Fred is here is that a number of the program areas that we have traditionally administered in St. Croix County, many of them on behalf of the state. As you're aware, counties are really partners and creations of the legislature. We often do things that the legislature says, we want this program or this area taken care of, and counties, you do it. Now, sometimes we get the funding for that, and sometimes we don't. And the ones that we don't, those are usually referred to as the unfunded mandates.
Right.
We're mandated to do them, but we don't get the money.
Yes.
Well, there are a number of these programs that we're going to need to be very careful as we begin our budget process in anticipation of 2012. And that's why I want Fred here, because he can speak with specificity to a number of these that I cannot. So.
Okay. Well, very good. And to round out the discussion, and again, not to get into super detail, but we also have highway and county aid for bridges and so forth. That's 31% of the budget, and public safety is 14%.
We usually say the big three when we get into the budget process. The big three are Health and Human Services, the Sheriff's area, Public Protection, and roads. Those really, from a department standpoint, are the big three in the county. They use up the majority of our budget.
Okay. And if there's going to be cuts, are you saying that it's more likely that it's going to be in those areas where the Health and Human Services that have these programs that they are required to be administered but may not get funded from the state, that those are going to have to be give the most consideration of those three, the big three you mentioned?
Well, that's possible. I don't know that I was trying to make that point, other than Fred's area is one of the largest areas, so consequently it's going to have a fair amount of attention given to it. We've already seen some indication that transportation aids probably are not going to be changed until into the 2012 cycle. that there'll be no change this year, and they'll be roughly the same in 2012. But in 2013, we'll probably see a reduction in the transportation area. Law enforcement, we're still trying to get our handle, the handle a little firmly more grasped than it is now in terms of what some of those changes in areas will be. But we are starting to have some clarity in the areas that Fred will administer.
Well, Fred, can you give our viewers some idea of how big the Department of Health and Human Services is or social services here in St. Croix County? Like, how many employees do you have, and how many constituents are served?
I think the last count in terms of employees, we have roughly in the neighborhood of 140 full-time employees and about the same amount that would be part-time. Varying degrees of part-time, anywhere from a couple hours a week to maybe a number higher than that, but less than full-time. In terms of the folks that we serve in St. Croix County, it really moves all the way from the cradle to the grave, because we administer programs through birth to 3 all the way to nursing home skilled care. So to give you an accurate account of numbers in all of those various programs, I didn't come prepared to tell you that today, but I can talk about a couple of programs where we do have some more specific numbers. They may not be exact, but they're certainly would give a ballpark. Before I get into that, I think it's important to note that right now we're in what I would quantify as our year-end closeout with the state. So right now our focus, while we're clearly starting to pay attention to some of the impact of the proposed biennial budget, we have to go back and close out all of our books for 2010. So the nursing home is pretty well taken care of, the health center, and right now the final reconciliation needs to be completed for all of our other programs by the end of this month. So that's first and foremost, to make sure we get all of the money that is due us in the door. And tomorrow, as a matter of fact, I'll be meeting with managers and our fiscal staff to make sure that we have accounted for all of the revenue that we had expected, and that should be completed again, within a couple of days.
This is revenue that would be over and above what is assigned to you from the county budget, say from the property tax or from the sales tax.
Right.
These would be direct grants from either the federal or the state government?
You're exactly right.
Okay.
Yep. So we're finishing that, and the reason that that's important is then we have accurate accounting of what came in the door for 2010, how close we were on anticipated revenues to actuals, and then we will start to take a look at our 2011 budget to make sure that, not start, but we will certainly be comparing those revenue streams to 2011 and then starting to do projections towards 2012. As Daryl had indicated, we're all going to need to take a look at budgets and see where the revenues are going to come in. Now, I'm not ready today to really get into specific detail because we have multiple funding streams that come in to support all of our programs from, again, cradle to grave. What I would like to talk about, if you are ready to get into maybe a couple of specific items that we have looked at in terms of the biennial budget and the impact of consumers, and maybe get back to one of your numbers in terms of St. Croix County residents that might be impacted.
Well, why don't you do that, like a specific program and how it might be impacted?
Yeah,
maybe before he does that, let me give the context of the budget that we deal with. The budget that we've adopted for this year is about $84.4 million. Of that, approximately $27.5 million comes from property taxes. The primary source that counties have for tax revenue are property tax, which is called the levy. That's how much we levy from property owners within the county. And then sales tax. We collect a 0.5% sales tax on retail sales in St. Croix County. Most Wisconsin counties do that. There are some that do not, but I think they're going to be carefully looking at that as some of our other revenue streams contract. So we have about $27.5 million that comes from property taxes, about $5 million that comes from sales tax, and the rest, as Fred indicates then, comes from a variety of sources. It comes from state aid, federal aid, fees for services, grants. That's what makes up the bulk then of our $84 million. So our 27 million that we levied this year for property taxes will be a stable source for next year. We're not anticipating raising the property tax. If we're looking at a shrinking revenue stream, our answer is not going to be to raise property taxes. That will be relatively stable. What we're looking at is the fact that some of our revenue streams that are going to affect areas that Fred is going to talk about will go down, and we know that.
Okay. And when you say some of these areas, because this biennium budget that was proposed by the governor is going to be considered now over the next couple months, one of those areas is the aid to local governments and specifically in the areas of Medicare and Medicaid. Is that right? Mm-hmm. And so this is what we're talking about?
And in addition, there's direct revenue sharing to counties. Our 2010 number was about $500,000. That'll be cut in half. So we know that next year our amount will be about $298,000. So it's going to get cut roughly in half. But
in that regard, St. Croix County is in fairly good shape compared to some of these municipalities. Like Superior, the city itself was getting, I don't know, 20-some million, I think. It's a very big number. And City of River Falls is even higher than what Hudson was.
Fairly good shape is a relative number. One of the things that concerns us as we're looking at our budget calculations and preparations for next year is the fact that we have continuing mounting delinquency in property taxes. And we become, in effect, a funding source for local governments. We're required to settle with the municipalities that we collect for and with the school districts, whether or not we've collected the money. So as we see that mount, that's an indication that there is some real pain out there in terms of paying property taxes, and that we're not going to raise that and contribute more to that pain.
Okay. So Fred, you were going to give us some examples then of maybe where revenue streams interruption might affect St. Croix County.
Either revenue stream interruption or how program administration might change that could interrupt services at the local level. And I say could because there's opportunity for more dialogue around how programs might be administered. But one such area is income maintenance administration. One of the details in the biennial budget proposal is to take that from the local level and have it administered centrally. Now, that might sound off the cuff as a way to save money, and it might. One of the concerns that I have about that at the local level, and I've talked about this with the Health and Human Service Board, with the Aging and Disability Resource Committee as well, is that centralization as it currently exists through the Enrollment Service Center for a couple of Medicaid and food share programs, the timeliness of processing applications and benefits is a challenge, I think.
Now let's clarify. When you say centralization, I think I know what that means. But does that basically mean passing the responsibility to somebody in Madison, or them taking control of that responsibility more?
I think that's a fair assessment.
Okay. And so anytime you have somebody down in Madison making the decisions, it could affect the response times.
Yes, and that's really what it comes back to is. I'll digress just a little bit. When we went to one point of access in our Health and Human Services building, it's a big building, and we had several points of access. When we went to one central location, or people had to come in and out of the building if you weren't an employee, we specifically made a point to move our economic support unit, which is the income maintenance administration, to the front of the building because the foot traffic through the building would have been considerable. And those are some folks that may be elderly and disabled that might make it difficult for them to get to the back of the building. So what we know through surveys is about 30% of the population that accesses economic support services really want that face-to-face communication. And if you centralize it, you're talking primarily about phone and internet access, maybe some locations that could be available at other points in the community like libraries and things of that nature. But when people are processing those types of applications, they often have questions and they call the local agency to really have their questions answered so they can accurately fill out applications to receive public benefits. To get back to a number that you had asked about earlier, we have roughly 10,000 individuals in St. Croix County that access medical assistance benefits, and we have about 5,000 people that access food share benefits. So you're talking about a fairly large percentage of the population. I don't know if it's 1 in 8 or 1 in 7, but we could do some quick math and figure that out.
Well, is that 5,000? That doesn't necessarily mean there's 5,000 different people.
It would be somewhat of an overlap. You're right.
Okay.
You're right. But let's even cut that 15,000 to maybe 12,000 or so. You are going to have a number of individuals locally that would be impacted by this administration centrally versus having access at the local level.
And by access at the local level, what does that mean to an individual?
Coming into our office, where we moved economic support from the back of the building to the front, so that individuals that come in to do applications or reviews or have questions, want to apply for energy assistance, child care subsidies, the whole component. They can do it online. Individual consumers in St. Croix County can do that online. But a lot of folks do choose to come to the local level to get those services.
Okay, and when you say those services, because you've used two different words, income maintenance administration and economic support, what are the more commonly known names for some of these programs so that folks can identify?
Primarily food share, what used to be called food stamps.
Okay.
And medical assistance, now known as Badger Care, and there's a couple of different types of Badger Care, but we administer the Badger Care benefits through our office as well. Eligibility determinations.
Okay. And do you also administer the program that I remember changed substantially when Tommy Thompson was governor, and then when President Clinton and the Republican Congress passed a lot of welfare reform, and we had work to welfare programs. Are those things being administered?
We do not administer the W-2 program. There's a private entity in the county that does that.
All right.
But one of the reasons why I would be concerned about income maintenance administration, economic support services at a central location is that hospitals, clinics, nursing homes rely on our department through economic support to process medical assistance applications in a timely fashion, so they have a billing mechanism. And if there's significant delays in time, if there's significant delays in or error rates are higher, those types of benefits at the local level that a variety of public and private sector entities rely on for revenue streams could be adjusted. For us at Health and Human Services, if you look at our funding sources, and I'll just pick our behavioral health clinic, about a third is insurance, a third is those individuals that might be on a sliding fee, and another third are on medical assistance. Well, if that medical assistance population, because we can't get access to benefits, and again, I'm assuming, and I may be assuming incorrectly, but if what we have seen with the Enrollment Service Center continues, we would likely have folks with delayed access to benefits. So if they come into our behavioral health clinic, for instance, they would not necessarily have medical assistance as a funding source. Individuals could move to a sliding fee scale, which costs more in terms of the tax levy to support the clinic for those services that we provide. So that is one of the reasons. Now, if I look at some positives around the biennial budget discussion around centralization, the state and the counties have been meeting and talking about alternatives and how could we put something out that might be more cost effective in terms of provision of the administration of economic support services, as well as keep a local presence. So I give the Department of Health Services a lot of credit in that they formed a team to work with county folks to talk about a blend between central and local. I think we know that at some point we're going to have to not just, and we've done this in a variety of programs that I could talk to you about if you ask me the right question, but we know that we have to be efficient, lean and mean, and we can't necessarily go into this thinking that business is going to be just as usual, that we are going to administer all of the programs the way we always have. So there may be a blend between central and local access that I think some of these discussions will generate some productive outcomes for the individuals in St. Croix County that access these public benefits.
Well, one of the aspects to your budget, I understand, would be the cost of these programs. That is the economic support that's given. There's dollars and cents involved in those, but also then paying your employees and the personnel. How much of your budget is salaries and wages and health care benefits and salary and benefits, and how much is the cost of the actual dollars going to the public?
I don't have that number off the top of my head in terms of overall programs, and it would depend on which program. So some of them were heavily laden in contracts, others are much more staff intensive. So I'd have to get back to you on that. I did not calculate that number for today's meeting.
But if it comes down to cutting things, I mean, there's raising eligibility standards, I suppose, would be one way to reduce that cost. The other would be to have fewer employees, whether it's not replacing ones that retire or whatever, and then trying to do more with less. What do you see, whether it's this biennium or the next one after, as the more likely trend? And either one of you could answer.
I was going to say, could I take that? Because I guess I would change only one thing that you said. I think instead of the phrase doing more with less, in all candor, I think we're going to be doing less with less. I just think clearly the role of government is going to be shrinking in terms of a number of the things that we've done. But I think that coming out of this process, I see more opportunities than I do problems. I mean, some people see a glass half empty, some see it half full. I guess I tend to be an optimist by nature. But early in March, I put out a memo to all of the St. Croix County mayors and the village presidents and the town chairs on exactly this subject, what I saw as opportunities, and I titled it Local Government Opportunities. And paraphrasing as quickly as I can, I simply said that the state budget is reducing funding for local governments as part of the effort to balance the state's projected $3.6 billion deficit. And I said the budget also contains levy limits for another 2 years. And then I talked about how the calculation was going to be in that. And then I indicated to my colleagues in local government, while there certainly can be various options concerning the specific budget actions, there can be no disagreement as to the need for change. Wisconsin has no money, and we can't spend what we do not have. And then I made this suggestion, and then this is the reason that I was writing to them. Over the past few years, it has become increasingly clear to many of us that opportunities exist for cost savings if we are willing to consider new methods of service. All of us have the same taxpayers to pay the bills, but frequently we provide overlapping or redundant services that drive up costs. And then I went on with a couple of observations, but I asked the mayors and the village presidents and the town board chairs to send me an email. Have you got suggestions? Are there things that you would like to talk about? Are there some areas that we can do things together? Can we share resources, share equipment, cooperatively lease or own some things? And I've gotten a number of suggestions back already, which encourages me greatly. What I know is the longer I'm involved in local government, the more I can see that redundancy costs us money. And we've valued in Wisconsin our local units of government. And in all candor, we've got lots of them.
Right.
And all of those cost us money. And if we can, as a result of what we're going through now, figure out new ways, better ways, more efficient ways of delivering those core services that our citizens need, and do it at a more cost-effective basis, then we all become winners.
Okay, so continuing to improve efficiencies by eliminating redundancy.
Well, if we can find those redundancies that we can eliminate. You know, as I look at a village or a town or a city, and they're providing some things that we could cooperatively do, either contiguous cities or villages or in cooperation with the county, let's look at those things. I don't consider anything sacred at this point as far as not looking at it with a very critical eye. First of all, is the program or service necessary? Is it being delivered by the right unit of local government? And could we cooperatively deliver it better? Let's look at those things.
Well, you heard what Fred was speaking of, delivering it better. Would you be generally open to some type of shared responsibility rather than centralizing everything in Madison and having everyone applying for their benefits there and not being able to have that local access, having some type of joint effort, if you will? Do you see that as an opportunity that you were envisioning in this memorandum?
Well, I wasn't necessarily thinking about that one, but back to that program, absolutely. If we can deliver it on a more cost-effective basis and provide a higher level of service without driving up that cost, sure. I've always been a believer that the best government is the closest government to the citizens.
Okay.
One of the things, if I can just jump in terms of estimated costs, that in terms of case processing for, again, looking at economic support, 2010 estimated average cost per case by the county administered program, we're talking about $283 per case. Estimated cost per case for the state enrollment support center or service center is $291. So this is information that the counties have pulled together in conjunction with state folks to take a look at what is the most efficient way to administer services. And I think in many ways, while this budget has certainly highlighted some of the things that we may have to change or alter or adjust, I think it's important to note that our Health and Human Services organization, I can speak for that, at least for the last several years, we've done some work around consolidation and done some work around creating more efficient services. I'll give you a couple of examples. One is we now contract for services with a private entity to do mobile crisis intervention. We work closely with our law enforcement entities in the county, not just the sheriff's department, but all local municipalities. When individuals are in crisis and they previously may have been taken to hospitals as a first choice, we now have a process in place 24/7 where we can dispatch mobile crisis workers that are trained to assess for risk of suicide. And certainly there are some folks that do end up in hospitals to make sure that they're safe. But there's a large degree of folks that are able to be safely diverted with safety plans back into their homes, into the community with other individuals that may be their friends, their neighbors, parents. It could be a variety of folks that can help, and then we have staff that do follow-up and make sure to the best of our abilities that we get those individuals service connected. Now that's important because when we do have people that are hospitalized that don't have insurance, even if they do, it's a large bill to the insurance company, or Medicaid, it's a large bill to Medicaid, but if they don't, that comes back as a cost to the county of about, over $1,000 per day. So it's much more cost effective for us to provide those services locally. Another example, I'll limit it to two, is in our family and children's unit. We have roughly anywhere from 20 to 25 kids at any point in time that are in placement. And placement can be anywhere from foster care all the way to juvenile corrections, and there's a few placement alternatives in between.
So this is countywide, 20 to 25 at any one point in time?
Yes, excluding kinship care cases, and that's when relatives step in to help out for kinship. They would be eligible for a kinship reimbursement, excluding those, because we've got more kids in that category.
Okay.
But the foster kids and the kids that might end up all the way into juvenile corrections, 20 to 25 at any point in time. And that's a relatively low number when you look at comparables between our county and other like-sized counties similar to St. Croix County. Now, the family and children staff do a wonderful job protecting kids and working with kids and families to make sure that they're safe and that we can find all kinds of alternatives short of placement. But we also have a good network of law enforcement and schools. And when I start naming other entities that certainly build a strong backbone of services in St. Croix County, I'm going to miss somebody. But we have a good network of services that really help to keep those kids and families together and in place. I lied, I'll tell you one other program. We developed a multi-systemic therapy program, which is community-based. I would say the motto of the program is whatever it takes, and the whatever it takes is really to transition those kids from placement services back into the home and to keep them home or to avoid those placements in the first place. We're the only certified program in the state of Wisconsin, and we implemented the program in February of this year, and we're starting to build a caseload for those 2 contracted staff. But back to budgets and numbers, why are those things all important is because $1,000 a day placement costs, if we go from 25 to 50, you double your expense, and we run through all of our state aids and get into levy pretty quickly for those types of services. So it's important in the biennial budget process to really look at and do the best we can with the resources we have available to make good, efficient, sound decisions on where we will spend our dollars, and obviously work not just with the staff but with the Health and Human Services Board and County Board as well. But we've done a lot of that efficient work, because if we don't, or if we haven't been as successful as we have been, we would be asking for a significant amount more tax levy dollars at the local level, because there isn't the funding coming from the other resources, state and federal.
Okay, understood. And this notion of efficiency, it's not like that's a new concept. I've heard some politicians say that for years, that this could be a way of reducing expenses. I just want to show one graph that the folks, this is page 42 from the 43-page presentation on the website, and it just shows the growth of the county spending. And see that it's on an upward curve that started leveling off in the mid-2000s, reached its peak in 2008, it looks like, at 92 million, and then it's dropped off by more than 10 million, and was 84 million for this year. What happened there, and if either one of you can address, did we have...
That's the ADRC, and I'll let Fred pick up on that, but yeah, that was a significant decline in the overall revenue dollars when we established the Aging and Disability Resource Center.
Yep.
Okay, explain that.
Actually, what happened, there was about 2 or 3 years worth of planning that was part of long-term care reform. And the counties used to administer all of the support services directly for the elderly, the younger physically disabled, and the developmentally disabled, that over 18. In 2009, we completed 3 years worth of planning to transition about 300 to 400 individuals in the categories that I just mentioned to a private care management organization, and at the same time we developed the Aging and Disability Resource Center. So we took a large component of dollars out of our budget, transitioned those individual consumers to Community Health Partnership, which is the private care management organization locally, and we opened the ADRC. So that's why you see that big drop.
Okay, so these ADRC and the private organization are not getting any tax dollars to run their programs?
The Aging and Disability Resource Center gets general purpose revenue, and then also they do 100% time reporting where we garner medical assistance administration dollars. They do not, at this point, have any local tax levy dollars going in to support the Aging and Disability Resource Center services. What we did as a county...
So it's kind of a standalone program at this point?
Well, it's under the Health and Human Services umbrella.
Okay.
There's still tax revenue going in, as he's pointing out. There's not local property tax levies going into it.
Okay.
The other thing that we did to pick up on, or to try to emphasize the efficiency component, is we took all of the ADRC services, which really is your public access point to long-term support services that are paid via a capitated rate, publicly funded capitated rate to the private care management organization. We took that service and all of the aging services and we consolidated them under one management structure within Health and Human Services, also with the Aging and Disability Resource Committee. So we were able to garner some efficiencies in terms of internal management and internal service delivery that also helped, I think, keep some of those numbers down. But the largest piece of that reduction in roughly $10 million was related to the fact that we were no longer administering services and we downsized staff and transferred all of those state and federal revenues, and actually we are doing a buy down of our local tax levy that was in the program as well. One of the main reasons we did that, I'll speak for myself, the county board may have other reasons they did it, but one of the main reasons I saw it as beneficial to St. Croix County is the notion that it eliminated wait lists.
Wait list.
Wait list, yes.
Okay.
Waiting for service.
Waiting for service list. And so prior to that, we'll take an elderly person, for example. They may have been on a wait list, but they weren't entitled to publicly funded services that would help keep them in their home. And when their ability to care for themselves reached such a level that they needed skilled care, they would be entitled to a nursing home. So we eliminated the wait list, or we thought we did, but in this biennial budget, back to the biennial budget, there's a talk about capping family care. So when I talked about the Community Health Partnership being the private care management organization that cares for the 3 target groups, in this budget there's also discussion about capping family care, and that is a concern locally for a couple of reasons. One, we have no infrastructure left to provide long-term support services for folks that may now move to a wait list. As I said before, part of the care management organization is funded by local tax levy dollars. So the other big carrot in this for St. Croix County was our local match to all of the $10 million in services was about $2.7 million. And over a 5-year period, that'll be brought down to about $376,000. But part of the deal was no wait list and take those resources and provide the services to individual consumers in St. Croix County that need support really in their own home. So how is that going to impact us at the local level? Well, right now I don't know how many individuals on the wait list that will now have to, after I think it's June of this year, a specific date in June, it eludes me right now what that date is, but that'll be the cap, and then anybody over and above that we can't get in either through crisis or through youth that are transitioning from our services that we provide to long-term support services. I'm a bit concerned about what that might mean at the local level.
Okay. So do you see the trend being towards more of this private outsourcing and consolidation of departments as far as the services, type of services you're providing?
I'll let Daryl respond, and I can as well.
Yeah, I think we'll see more of that. I think we'll see more contracted services. I think there'll be a shrinkage through attrition. I'm not anticipating that we're going to see disruption by loss of jobs, but through attrition and consolidation of programs, I think the number of employees is likely to contract.
Okay. And Fred, did you have?
Well, I think when I think about public and private sector work, I don't put one on a pedestal above the other. I think we're equal partners providing services to a variety of individuals, at least in the health and human services arena. We just need to have, I think we need to have balance in that. So, as I said earlier, we have a large portion of our budget that is contracting for services. You highlighted roughly $10 million worth of contracts that the county, as a public entity, isn't providing those direct services but was contracted. So when I think of public and private sector, I like to think about a healthy balance between the two. One of the functions of the ADRC, if you will, is to be the gatekeeper of who is eligible for publicly funded services. So while we may have got out of the business of providing direct services to those individuals, we are in the business of actually administering the functional screens. Our economic support unit does the financial screens, and together that is the access point to publicly funded services. And I think that's a reasonable role for a governmental entity to play.
Okay. Is there any other points that you wanted to bring out at this time, Daryl? It sounds like it's a work in progress that we have to wait and see ultimately what gets passed. Obviously, it's just a proposed budget at this point, and then there will be working out the kinks as you leave the 2011 budget year and then venture into a new budget under the new state biennial budget.
We're starting our budget planning for 2012 earlier than we normally do. As a matter of fact, we have a county board work session on the 14th of April that's scheduled, and we'll have another one on the 12th of May. We'll be meeting as committee of the whole, which is the county board, but we're meeting as a work session, not as a legislative body. And that's earlier in the process than we would normally do, but the magnitude of what we're looking at in the state and in the local units of government is such that we want to be as far ahead of the power curve, using an old pilot's phrase, as we can. We just want to be prudent and careful. I think that we're going to see, as St. Croix County, certainly, and likely other local units of government, do their budget planning for the next foreseeable number of cycles, more emphasis on the spending side as the starting point as opposed to the revenue side. We know there will be contractions in revenue, and I think that we're going to start with a determination of what can we spend, and then anticipate against that what are the revenues that we have to accomplish that spending. Primarily, we've had revenue-driven budgets before. We say, well, we've got this much revenue coming in, so the expectation is let's spend it. I think the reverse is going to be true, including, I think, we're going to be forced to have a couple of things as part of our normal expectation for spending, and those will be continued emphasis on appropriate reserves. You indicated earlier in some of the things that St. Croix County has done. I think because we've been very prudent and very careful with our reserves, we've weathered some of the storms that other counties have been in over the last couple of years. We've not had furlough days. We've not had contraction of hours. We've managed, I think, fairly prudently. But we want to be very careful in continuing to maintain appropriate reserves. The other one is our capital spending. We have largely, for the last couple of cycles, balanced our budget as we get to the end by pulling some capital items out.
By deferring
them. And as a matter of fact, doing exactly what I earlier criticized the legislature for, and that's moving it down the road. And we would say, we can't afford this capital this year, but we'll move it down here and we'll deal with it next year or the following year. I think we're
when costs go higher and
well, when times are better, I guess we would say. But I really think that we're going to need to say, we need to continue to have this investment in our infrastructure, whether it's in our buildings or our roads or whatever it is, and have that as an item in our budget and know that we have to do it. Everything that's delayed costs more in the future, and so incrementally we're going to need to plan for those capital items and have it part of our spending profile.
Okay, one thing that I think I would be remiss in not mentioning, and at least asking, given the changes in funding from the state level, what impact might that have on the nursing home? Because the nursing home has been a very big topic over the last several years, and the goal being to take it off of the tax levy. What impact is this legislation going to have on that issue? Is the nursing home going to have to be closed? Is that reduction in funds going to have to happen sooner than it was originally planned? Can you fill us in on that?
I'll take a run at that, and then I'm going to have Fred also pick up on that. This is not going to have a single out effect on the nursing home. I mean, as a result of this is going to happen to the nursing home. As a matter of fact, I have stressed to the Health and Human Services Board in the last couple of months when we've been meeting and looking at some projections and pro formas, that it highlights the fact that we cannot look at the nursing home in isolation. It's part of everything that we do. And there certainly is going to be an increased scrutiny of the nursing home operations, but I don't think any more than in any of our other operations. The nursing home has been a challenge for us for a number of years. It will continue to be a subject that merits a high level of discussion, and what I'm going to have Fred comment on is that the Health and Human Services Board has been very focused on looking at some business plan models that we're going to be bringing to the Committee of the Whole to look at, again, not in isolation, but in the context of everything that we're doing, because that is a fairly large component of our personnel profile in the county. It's a fairly significant and long-standing program, and it generates a high degree of public interest. So
from both sides, yes.
It is going to be a focus, but at this point, there's no plan for the nursing home other than it will continue to be analyzed in the context of our budget like every other program.
Okay, and in adding to that, Fred, whether it's you or Daryl, give me the history, because I don't have the numbers in front of me, and you have dealt with this since 2005. What was the levy portion of the nursing home, and what was the goal and the timing of that, and what is it currently?
I can tell you that back in 2005, the levy was about 1.3 million, and today it's about, well, if you take into account current year tax levy and prior year carryover, so money that we didn't use, if we didn't have it for the current year would be tax levy, it's right now about 600,000. So
less than half of what it was.
Yeah, roughly
okay.
that type of a reduction, yes.
Okay. And what you were going to add to his answer?
The piece that I would just add at this point in time is Daryl's absolutely correct. We've been talking about business planning and models, and when we brought on a nursing home administrator, we did sit down and talk about with a variety of stakeholders a long-range plan to get the nursing home off the levy. But the current conversations have really focused in on, is that possible, practical? Are we going to get there or not? And the current business plans still show levy needing to subsidize the operation. I did some research, look back at, because this hasn't been an issue that just started in 2005. There has been discussion on the nursing home and should we be in the business or not for quite some time. But I look back to 2002 and there were really 4 items that I thought were noteworthy in previous minutes. One was consider downsizing. So I think in 2003 we went from 129 to 72 in terms of skilled beds available.
Okay.
One of the other things, I was just scratching a couple of notes, operational efficiencies, staffing to census. So if we are at 65 residents, we're not staffing like we're at 72. Pretty reasonable concept. And we've made those adjustments over the last several years as well. Some technology enhancements. So we are doing a lot more of our charting at computer kiosks, if you will, at the nurses' stations or at various spots around the facility to be able to do more accurate charting on residents' needs, as well as that enhances reimbursement, so you're accurately recording what you do in a more timely fashion. The fourth item that we really talked about the last couple of meetings more directly is wage and fringe. And we've had audit reports from Larson Allen that highlight some of our wage and fringe is higher than our comparables in the area. And so updates at this point in time for the Health and Human Services Board April 8th will include what would we need in terms of a dollar amount to either keep a levy of approximately 100 and, I can't remember the number exactly, but let's just say $150,000 for the foreseeable future, or what would we need to have zero levy in terms of wage and fringe concessions. And I think then the opportunity to sit down with staff to have reasonable dialogue about how could we make this work together is one of the next steps for the Health and Human Services Committee to consider, that then could be brought to, I think Daryl referenced the Committee of the Whole discussion coming up in April, which it really could be a more specific conversation at that point in time.
Okay, well, very good. Well, we covered a lot of ground, and again, a topic that needs to be covered again, I'm sure, once we know more information. But thank you for your expertise and for your information. And
Thank you.
Thank you.
Thank you for coming. Good to meet you.
Yeah, nice meeting you.
And Daryl, I'm sure we'll be hearing more, because this is, like, again, only 1/3 of the entire county budget, and so we've got other areas to address as well. I look forward to talking to you folks as well in the future about St. Croix County and county government in general. And again, thank you for joining us here on Western Wisconsin Journal.